Now, 10% of women are affected by endometriosis. It can be painful, debilitating, and it can lead to fertility issues. And March is Endometriosis Month, so we have asked Dr. Frances Patsillis to provide her expert advice on its causes, symptoms, and treatments. Good morning, Dr.
Morning,
Frances.
Mel.
Lovely to have you here. I think this is something that affects a lot of people. What exactly is endometriosis?
Endometriosis is a serious debilitating disease that tends to get diagnosed in women in the reproductive age group about 25 or 30. And what's interesting about it is that it's about 60% of chronic pelvic pain patients,
Wow.
and about 50% of people with infertility have it. And it's a situation where you've got endometrial tissue, the tissue that normally lines the uterus, in other places, typically mostly around the pelvis and often in the ovary.
Gosh, can it run in families?
Yes, it can. And in actual fact, it's genetic and it's associated with people who start periods early, have short cycles, fewer births, and over or underweight people.
So what actually causes it though?
Now, it's quite complicated, so I'll try and keep it simple.
Yeah, please do.
There are hormonal issues. There's too much estrogen that can potentially become bad estrogen. There's also not enough response to the body's natural progesterone. The immune system is very highly involved because you have all these inflammatory messengers going out into that tissue, which then affects the rest of the body, which is why you can have other chronic diseases with it. The natural killer cells are suppressed, and even genetically some people haven't got enough ability to make those bad estrogens into neutral estrogens. So there's all this complicated stuff that keeps creating a vicious cycle.
Is it possible to have endometriosis and not realise it? I mean,
yes, because you might just think, how do you know that your periods are really painful if you've never known anything else? How do you know if they're not particularly heavy, or that sexual intercourse shouldn't be painful, if you haven't compared yourself with other people? And sometimes the symptoms are not classic.
So pain, heavy periods are some of the symptoms. What are some of the other things that could let you know that you do have a problem with it?
Well, I think really just not functioning well, fatigue, low back pain, bladder and bowel issues.
Because that seems interesting that it would affect your bowel as well.
Yes, because it doesn't just stay in the pelvis, it goes around the bowel as well. It's even been found in the lungs, so generally down that part of your anatomy. Yeah.
How do you diagnose it then?
Well, it's not easy to diagnose it just by looking at symptoms and signs. Really, ultimately, I think most people need to have a laparoscopy for two reasons: to help make sure that you've got the right diagnosis, but also it's often therapeutic because the surgeon, the gynaecologist, can sort of take some of the bad tissue away and improve some scar tissue and help you with your pain.
So what would be the varying degrees of it? What would a mild case look like?
Well, I think there'd be people who have laparoscopy for fertility and never knew they had it and never had symptoms.
Right.
So there are people who don't have symptoms at all, right through to people who have debilitating symptoms that ruins their lives.
Okay. What about other conditions that might be associated with it?
Yeah, well, what's really important about this is that you can have thyroid problems, allergy, hay fever, you can have autoimmune diseases. This is because of the involvement of the immune system. So autoimmune diseases like rheumatoid arthritis, celiac disease, lupus, multiple sclerosis. People who then have to be very careful with their diet and they start reacting to histamine foods that they don't know they're reacting to.
Right. So they could be having all these issues and not actually realise that endometriosis is part of the problem.
Oh, exactly. Sometimes I see people with a whole lot of can't sleep, general pain sometimes. Maybe they've had a cancer diagnosed. Now that's important to mention. Some cancers are also associated with endometriosis. So they come along, but typically they've already had the endometriosis diagnosed, but they've got a whole lot of other problems that go with it.
Right. So if you have any of these symptoms, like particularly painful periods, go and see someone about it. Don't suffer in silence.
Absolutely. If you're not sure, or always get these sorts of things checked.
Okay. So what is the treatment then? If you've got it, it's not a life sentence, you can actually do something about it?
If you can manage to conceive, it does help, although it can be hard to conceive.
Right.
somewhere along the line, the laparoscopy is often part of the treatment.
Is that?
Yeah, that's going through your belly button and having a look.
Okay.
Yeah. Often the contraceptive pill is used because it's a well-tolerated, highly successful treatment. But in some cases, the specialists use cycle-suppressing treatment, which doesn't last very long because people don't like having menopausal symptoms.
Right.
And I think that there's a role for the natural bioidentical progesterone because after all, your body has been resistant to the action of your own progesterone, and we know that natural progesterone helps to counteract bad estrogens.
Is surgery also an option?
Oh yeah, and that's the laparoscopy.
Oh, right, okay.
If possible.
So they go in and get it all
Yeah,
out?
rather than opening you up and doing things, they tend to do it through the keyhole.
Okay, great. Well, thank you so much for that. That has been enlightening. I'm sure there's a lot of people nodding at home right now going, well, I have these symptoms, so hopefully you can do something about it. Thank you, Dr. Francis. And if you are concerned about anything that we've discussed today, please make sure that you consult your health professional.